Hey everyone. So to answer the 5 questions for this discussion board, for the first one, why use theories in clinical practice? I think this is to build a relationship with patients and their families. And this is presented as McCrae 2011 described it as the trinity of nurse roles as a practitioner, partner, and leader. I also think that nursing theories help nurses define their role as professionals so that other professionals like medical doctors are not the ones defining what the nursing profession is, because they are most likely going to have a different interpretation that can lead to misunderstandings and misconceptions in society of what nursing is. I also think that nursing theories help nurses base their interventions when providing patient care. So it helps them make good decisions and rationalize why they choose to provide care in one way over another. So why take this route for a patient or like do this method over another? So overall, nursing theories help improve nursing care because it allows nurses to express what they do for patients and explain the reasons why they do it, which is stated by Eunice and Quinnell 2019. For the second question, does theory use make a difference in care? I think theories make a difference in care because it helps improve patient care and patient outcomes by guiding the development of a nursing care plan for each patient. I think that applying nursing theories can help patients be more autonomous in their own care. So for example, Eunice and Quinnell 2019 reviewed an article that found how Orum's self-care deficit theory could be used to decrease fatigue in patients with multiple sclerosis. And they found a significant difference in fatigue in patients in the intervention group compared to those in the control group. Because in this theory, Orum believes that all patients want to care for themselves and they are able to recover more quickly and holistically by doing their own self-care as much as they're able to do so. So basically, this nursing theory guided interventions that improve patients' quality of life, self-efficacy, and their own self-care. For number 3, how would you know if a nurse was using a theory to support working with a patient? I think you just have to ask the nurse why they are caring for a patient the way they're currently caring for them. Like, how did they come to the decisions for a patient and why? It's important to understand a nurse's values and beliefs about how they think human health processes work, what their role in optimizing human health processes are, and how their interventions fulfill the patient's needs, values, and beliefs. For the fourth question, what would you notice if a nurse was not using theory to support working with a patient? I would notice that the nurses would be practicing using the traditional nursing care that is based on traditional knowledge, Eunice and Quinnell 2019. And just to define it, traditional nursing care is based on medical knowledge. So Eunice and Quinnell 2019 provided a good example in their article of traditional nursing practice in comparison to nursing theory guided practice. And this is when they describe that a patient who refuses treatment is considered non-compliant, and using traditional nursing practice, or that's what traditional nursing practice would be, is that they are just stating like, oh, the patient's not refusing treatment. But then a nurse who uses a nursing theory guided practice, their approach would be different. They would try to understand why the patient is refusing treatment in the first place and also do their best to adjust the care plan specifically to the patient. So basically, traditional nursing practice kind of like just accepts things as they are on the surface, whereas a nurse who practices within nursing theory dives deeper to understand their patients and their patients' needs. And then for the fifth question, how could theory use in the clinical setting impact nursing quality, safety indicators, and patient outcomes? I think it's based on how well patients meet their basic human needs, which ties in Virginia Henderson's description of the purpose of nursing through her nursing need theory. And to define that theory, it's to respond that nursing is the role of nursing is to respond to the needs of human functioning through 14 items, which include breathing, eating, drinking, eliminating, sleeping, maintaining temperature, cleaning themselves, avoiding injury, and communicating and expressing their emotions, etc. So that's from McCrae 2011. Henderson argued that nurses must help patients to be independent and have the ability to do things with little to no help by educating and encouraging them to care for themselves so they can take ownership of their own health. And with that, they can continue to thrive in their communities and environment because sick patients have a desire to return to their health. And so nurses, their role or what they do is they devote themselves to the patient in a supportive environment until patients can achieve a health status where there is a healthier balance between what's going on in their body, how they're feeling, and reaching like a higher level of health in comparison to where they were based on a disease or an illness that they're going through. Thank you.